Have you ever walked into a health checkup feeling just fine, only to walk out more confused, anxious, and overwhelmed than before? Maybe it was just a routine visit, something you've done a dozen times before. But this time, they said your results were a little off. Maybe they ordered more tests. Or recommended a scan. Or worse, hinted that something might be wrong. Now you're stuck in limbo. Waiting. Worrying. Wondering if you made the right choice. It's a scenario that plays out every single day, especially for people over 70. The truth is, many routine health checkups we've trusted for years may not offer the benefits they once did. In fact, some of them could actually do more harm than good. I know that might be hard to hear. After all, we were raised to believe that prevention is always better than cure. And while that's often true, it's not the whole truth. Especially in our later years, when the risks of testing often rise and the rewards may not be as clear as we think. In today's video, I want to gently walk you through 5 common health checkups you may want to avoid, or rethink, after age 70. These aren't scare tactics. They're smart, evidence-based insights that can help you or your loved one age with clarity, safety, and confidence. And by the end, you'll have a better understanding of what tests to question, how to talk to your doctor, and how to protect your peace of mind, not just your lab results. So if you're over 70, or you're caring for a parent or spouse who is, this message is for you. And real quick, if you believe in wiser aging, if you're someone who values thoughtful, practical health guidance in your senior years, I invite you to comment, "I'm here," below and subscribe to Elderly Health Central. We're here for you every single week. Now let's get into it. Checkup number 1, the PSA test for prostate cancer. Let me tell you about Mr. James. He's 74, retired, plays golf twice a week, and loves spending time with his grandchildren. He's healthy, has no major complaints, but at his annual checkup, his doctor offers him a PSA test. It's just a blood test, the doctor says. Takes a minute. So Mr. James agrees. A few days later, the results come back. His PSA is slightly elevated. What follows is a whirlwind: more tests, a prostate biopsy, hours in waiting rooms, fear, stress, and a lot of sleepless nights. His family worries. He feels anxious all the time. The biopsy finds no cancer. But the damage is done. Emotionally. Mentally. Spiritually. So what went wrong? The PSA test measures a protein called prostate-specific antigen in the blood. Elevated levels can indicate prostate cancer, but they can also be caused by age, inflammation, even a recent bike ride. And here's the kicker: most prostate cancers in older men grow very slowly. Many never cause symptoms. Many never spread. And many don't need treatment at all. But a positive PSA can start a chain reaction, leading to biopsies, radiation, and even prostate surgery, which can result in incontinence, erectile dysfunction, and other long-term side effects. Medical guidelines are changing for a reason. After age 70, the harms of PSA testing often outweigh the benefits, especially for men without symptoms or a family history of aggressive prostate cancer. So if your doctor recommends a PSA test, ask, what are we looking for? What would we do if it comes back slightly elevated? Is this test truly necessary for someone my age? Remember, not all knowledge is helpful. Sometimes, it only brings anxiety and unnecessary decisions. And sometimes, peace is the better medicine. Checkup number 2. Full body scans or PET scans when you feel fine. Now let's talk about something that sounds high-tech and futuristic: full body scans. Private clinics often advertise them as cutting-edge prevention. Catch disease before it starts, they say. Buy yourself peace of mind. But what they don't say is this: full body scans often lead to false alarms. Take Ms. Rosa, for example. She's 76, vibrant, and living independently. She saw an ad on Facebook for a full-body scan. It promised to detect cancer, heart issues, and other hidden problems before symptoms ever appeared. It seemed like a good idea. So she paid out of pocket and got scanned. The results? 3 suspicious findings. A spot on her lung. A shadow on her liver. Something odd near her thyroid. Over the next 6 weeks, she had more tests. Blood work. Ultrasounds. A CT scan. And guess what? None of it was serious. None of it needed treatment. But the anxiety? That was very real. And the cost? Thousands of naira, and countless sleepless nights. Full-body scans, especially PET scans, can detect incidental findings, harmless growths, cysts, or age-related changes. But once you see them, it's hard to ignore them. Doctors feel obligated to investigate. Patients feel scared to do nothing. Add to that the high dose of radiation from some of these scans, and you've got more harm than help. Unless your doctor specifically recommends a scan based on symptoms or existing conditions, avoid these one-size-fits-all checkups. They're not preventive, they're anxiety traps. The truth is, your body isn't a machine that needs a full diagnostic every year. It's a living, breathing, aging miracle. And it deserves thoughtful care, not industrial testing. Checkup number 3, bone density tests when you're not high risk. Let's talk about bones. After 70, many women, and even some men, are told they need regular DEXA scans to check for osteoporosis. But here's where it gets tricky, not everyone needs them that often, and not everyone with low bone density needs medication. Let me share the story of Auntie Maggie. She was 73, no history of falls, and in relatively good health. Her doctor ordered a DEXA scan. The result? Osteopenia. She panicked. The word sounded scary. Her doctor prescribed a strong bisphosphonate medication. Within 2 weeks, she started feeling dizzy and nauseous. One night, she got up to use the bathroom, lost her balance, and fell. She fractured her wrist. Ironically, the medication that was supposed to protect her bones may have contributed to the fall. Here's what many people don't know, osteopenia is not osteoporosis. It simply means your bones are slightly less dense than average, but not dangerously so. And in older adults, small decreases in bone density are often normal. More importantly, DEXA scans don't measure bone quality, they measure bone quantity. And bone quality, which affects fracture risk, can't be seen on a scan. If you've never had a fracture, have no strong family history, and you've already had a normal scan in recent years, you probably don't need another one for a while. Instead, focus on what matters most: weight-bearing exercise, protein-rich foods, vitamin D from sunlight, fall prevention in the home. A scan might tell you numbers. But movement builds resilience. Checkup number 4, ECGs or cardiac stress tests when you feel fine. Heart health is a major concern for many people over 70, and rightly so. But it's easy to confuse being proactive with being excessive. Take Uncle Dan. No symptoms. No chest pain. No shortness of breath. Just wanted to stay ahead of things. So his doctor ordered an ECG. It showed a few age-related changes, nothing alarming. But just in case, the doctor ordered a stress test. That led to a referral to a cardiologist. Then came an angiogram. And before he knew it, Uncle Dan had a stent in his heart, for a blockage that wasn't causing any problems. He spent 2 days in the hospital and took 3 months to recover emotionally. The kicker? Studies show that placing stents in people without symptoms doesn't improve survival. It doesn't prevent heart attacks either. It just adds risk, cost, and stress. The takeaway? Heart tests should follow symptoms, not fears. If you're having chest pain, dizziness, fatigue, or breathlessness, absolutely get checked. But if you feel well, and a test is offered, just in case, ask, what's the likelihood this will help me? What would we do with the results? Are there safer alternatives? Your heart deserves care, but it also deserves wisdom. Checkup number 5, colonoscopies after age 75 with a normal history. And finally, the colonoscopy. We've been told over and over, it's essential. It saves lives. Everyone should get one. And that's largely true, in middle age. But by the time you're in your late 70s or beyond, the benefits of colonoscopy start to decline, while the risks increase. Take Bernard, 78, relatively healthy, and always diligent about checkups. His doctor recommended another colonoscopy. His last one was over 10 years ago. He reluctantly agreed. The prep alone left him weak and dehydrated. The sedation confused him for days. He was disoriented. Lost his appetite. Felt depressed. And it took nearly a month for him to bounce back. The results? Completely normal. Here's the thing, colon cancer grows slowly. If you've had clean screenings in your 60s, and you're not showing symptoms, continuing colonoscopies in your late 70s may offer little benefit. On the other hand, the prep, sedation, and risk of complications, like bleeding or perforation, become more serious with age. Many medical guidelines now suggest stopping routine colonoscopies after age 75, especially if past results were normal. And if screening is still needed, less invasive tests like fit stool tests can be good alternatives. It's not about avoiding care. It's about choosing the kind of care that honors your body's stage of life. Now let's take a breath. That was a lot of information. And if you're feeling a little overwhelmed, that's okay. These decisions aren't easy. Saying no to a test your doctor recommends can feel scary. Saying not now can feel risky. But here's what I want you to remember, you are not a passive patient. You are a wise decision maker. You have the right to ask questions. You have the right to choose what works for you. And you have the right to say, I want care that helps me live better, not just longer. Because in the end, health is not just about tests. It's about living with comfort, dignity, and peace. So let's quickly recap. Here are the 5 health checkups you may want to avoid, or rethink, after age 70. 1. PSA tests for prostate cancer if you're symptom-free. 2. Full body or PET scans without a clear medical reason. 3. Routine bone density scans unless you're high risk. 4. ECGs or stress tests when you have no heart symptoms. 5. Colonoscopies after 75, especially if you've had normal results. Have you, or a loved one, experienced one of these tests that led to more stress than clarity? Please share your story in the comments. You never know who you might help. And if this video opened your eyes, gave you clarity, or just made you feel a little more confident, please subscribe to Elderly Health Central. We create videos every day to support you, your health, and your peace of mind. Thank you for watching. Thank you for caring. And most of all, thank you for aging with wisdom. See you in the next one.